A lot has been said or discussed about insecurity among doctors in their clinical practice. The way I understand it is, a person becomes a good doctor and then achieves a lot of clinical excellence in that field, and then they are not able to share it or impart that knowledge among their subordinates and junior doctors. One way I think one can get over this is by making sure that you achieved all the skills one should have to treat your patient very well, and also be able to work in a larger teams. The advantage of teamwork will naturally quell the insecurity, because at any given time you're part of a bigger team. And it's the same old concept that, if you are one of those who believe that, I want to have a small piece of a large pie, then you will be very content that you are always going to be doing good clinical work. At the same time, the thought process of insecurity will be nullified. Work-life balance has been always discussed, and it's a subject a little dear to me, particularly from a doctor's point of view. I think it's important. I think one can get the best out of anybody only when they're able to do a lot of good for themselves and for people around them. So what they should do, I think, is they need to find a comfort place to work, have very good colleagues, very good communication skills, and then once that is sorted out, they should then interact with the clinical colleagues that they're working with to do things which are of common liking. So they can always share the workload together and enjoy the work. At the same time, always find other options, find hobbies or common interests. Again, that can have a healthcare team. A good example I could give you would be, say, for example, you're doing a lot of work, and at the end of the day's work, you're thinking how you can try and mix your life, your home life. So you can inculcate good habits among the doctors to sort of engage their families, to do something together among families. You can possibly do, for example, a Sunday morning, a walkathon would be a good example, where you're doing work, but at the same time, you're mixing some of the family time along with the work. So I think one can achieve a good work-life balance, but the chief ingredient probably for me would be to work in larger teams to try and get the balance right. So an interventional radiologist in cancer can offer a lot of things. Just a little background. Generally, when we talk of oncology care, we talk of three pillars. One is surgical oncology, where the surgeon is able to operate on a tumor or a cancer in the body. A medical oncologist who is able to give advanced chemotherapy to help the patient. Again, the third component being a radiation oncologist, where they're able to use very sophisticated means to deliver high-dose radiation to treat cancers in the body. And all these three pillars work together. What has been in the last few years a huge addition to this is interventional oncology. What it really means is an interventional radiologist who is able to offer an interventional oncology procedure, and all these procedures are minimally invasive. They're daycare procedures, they're done under local anesthesia, and this complements very well with the other three pillars. So interventional oncology today is the fourth pillar of oncology care. And if any hospital today has to reach a center of excellence in cancer care, I think interventional radiologists will play a huge part. There are many examples I could quote. One simple example would be of liver tumors, because in the center that I work, we do a lot of liver cancer treatment. If a liver cancer is in the liver, where unfortunately, let's say the patient is not able to undergo a transplant surgery or surgery per se, or is not fit for an operation, then before there were not many options. But today with interventional oncology, one can treat the tumor with something called microwave or radiofrequency ablation. They can also go into the artery which is supplying the tumor and do something called chemoembolization, that is putting chemotherapy into the artery supplying the tumor, and also to block the blood flow to the tumor this way. And then there are many other examples. For example, let's say cancer is blocking a particular passage in the human body, then that passage can be treated without actually operating. So what happens is there's no need of general anesthesia in this particular scenario. We can offer minimal invasive procedures using a keyhole technique, and then treat these blockages of cancers in the body. And this helps in palliating the patient very well, because it's not in the cancer per se. What happens is, if we have to treat the person, it's not always the three pillars, but there's a lot of palliation which is required. And therefore, an interventional oncology can help in a big way for these patients. One of the nicest things which has happened for all of us who are part of the Global Hospitals team is that Number one, we work in teams. We truly believe that multidisciplinary approach is important in managing these patients. So we interact with each other to get the best for our patients. And we in the Global Hospital Group were the first in private sector hospitals in India to form a department called Interventional Radiology and Interventional Oncology, where we cover a wide range of procedures in interventional radiology and interventional oncology. And the second important thing we have done in Global Hospital is we have trained a lot of junior radiologists who have an interest to become interventional radiologists. And in the last 6 years that I have been part of the global group, we have trained well over 10 junior radiologists to become successful interventional radiologists who have then gone to different parts of India and working very successfully. So it's a sense of pride that we have inculcated teamwork, inculcated practices which are best for the patients, and then we are able to reach out to more number of peoples within our country.